Hi, my name is Andrew Rule. I am a nephrologist and epidemiologist at the Mayo Clinic in Rochester, Minnesota. I'm going to present an article that was recently published in the Mayo Clinic Proceedings, the April 2011 edition. The title of this article is Association of Kidney Function and Metabolic Risk Factors with Density of Glomeruli on Renal Biopsies of Living Kidney Donors. So what were the findings of this study? Well, what we did is we took about 1,000 living kidney donors who donated a kidney to a patient with kidney failure in Rochester, Minnesota over the past decade. And during their surgery, a biopsy was taken of the kidney. This biopsy was sectioned and stained, and from these biopsy samples we were able to measure the area of cortex on the biopsy as well as the number of glomeruli. By dividing the number of glomeruli by the area of cortex, we came up with a parameter we called glomerular density. Now, the interesting question we wanted to ask is, does glomerular density relate to clinical characteristics of the living kidney donors that were measured before they donate? Now, living kidney donors undergo a huge battery of tests in order to assess the health of their kidneys and overall metabolic status before they donate. And the answer to this question was a resounding yes. Glomerular density was associated with many different metabolic and kidney function abnormalities in living kidney donors. In particular, a decreased glomerular density was associated with older age, increased or hyperfiltrating glomerular function. It was also associated with a family history of end-stage renal disease, obesity, and an increased serum uric acid level. And it was independently associated with each of those 5 clinical factors. In addition, it associated with increased urine albumin excretion, hypertension, and metabolic syndrome, as well as a decreased HDL cholesterol. So why are these findings important? Well, it's important to keep in mind first that living kidney donors are in general a very healthy group of patients. But health is a relative term, and even in a group of kidney donors, there is substantial variation in kidney function as well as metabolic risk factors. And what these findings show is that metabolic risk factors in kidney function, even in healthy adults, are associated with structural changes in the kidney. And the structural change we found was decreased glomerular density was associated with the metabolic risk factors and subtle abnormalities in kidney function. Well, what does decreased glomerular density represent? Well, what we think it represents is an increase in the average size of nephrons, and there's actually other data and other studies that have shown that the glomeruli can actually hypertrophy in response to metabolic stress. And I think what we found here was another way to measure this, and we could show that it's associated with many different characteristics in donors. Keep in mind that some metabolic risk factors such as diabetes and cardiovascular disease are not present in this population, since these individuals would be excluded from kidney donation. So the fact that we could find so many associations in this healthy population makes these findings even more important. So what is the next step in this line of research? Well, there's a couple of avenues we'd like to pursue. First, in addition to having a measurement of the glomerular density based on the kidney biopsy, these living kidney donors all underwent a pre-donation CT scan, which would provide a measurement of the cortical volume of the kidney. By combining the cortical volume of the kidney with the glomerular density, we can estimate the average number of nephrons in this population. And this would help us study whether nephron endowment, that is the number of nephrons you're born with, is associated with metabolic risk or cardiovascular risk or kidney risk in individuals as they age. The second avenue we'd like to pursue is to actually measure outcomes in these kidney donors, particularly things like mortality, cardiovascular disease, and eventually even things like kidney failure. However, we would need to increase our sample size and to have a lot longer follow-up, since this group is relatively healthy and will have relatively few events in the near future. So the takeaway message of this article is that in even healthy adults, there are structural changes on the kidney that can be seen by a sampled biopsy of the cortex. And these structural changes of decreased glomerular density are associated with metabolic abnormalities and subtle abnormalities in kidney function of healthy adults. This decrease in glomerular density is likely represented representative of an increase in the average nephron size that occurs in response to metabolic stress. Thank you.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.